Most of you know me. I'm Trevor. I know I'm not on video right now, but I'm a nurse practitioner that started Valley Vital Medicine about 5.5 years ago. And just super excited to have Emily, who has joined our team in the last about 2.5 months. And she's done a really great job with many of the clients that she's been able to see. And she's been getting some great feedback, learning a lot, and she's a huge asset to Valley Vital Medicine, to our clients. She is really bringing cutting edge hormone therapy to the Fargo-Moorhead area. And we're offering some really unique things, really unique approaches to hormones. And I think you'll really appreciate the information that she has to share tonight. As I was mentioning just a minute ago, we do have a Q&A box at the bottom of this webinar as well. So if you have questions as we go, please type those in there. We'll make sure that those are answered here at the end for you. And we want to make sure that you guys get the absolute most out of this presentation. So with that, I'll turn it over to you, Emily. Thanks so much for doing this tonight.
Yeah, thank you for the introduction, Trevor, and thank you all who are attending live. It's really great that you guys are here. I hope that you find this information helpful. I know I've been learning so much, and I'm excited to share with you guys today some of this information that I've been learning. So tonight we're going to talk about confidently aging. So we're going to be talking about taking more of a functional approach to optimizing your hormones, more specifically in perimenopause and menopause. So my goal is to help you ladies feel, empowered, reclaim the energy, better mood, get that glow back, and, feel confident this next part of life that we transition into as women. So, a little bit about me. So, my experience as a nurse practitioner was in urgent care and also doing Medicare health assessments. And during my time working with those populations, I quickly realized that a lot of women in their 40s and up were really struggling with a lot of symptoms that were consistent with perimenopause and menopause. And a lot of their practitioners were putting them on tons of different medications and denying them any sort of hormone replacement therapy. And oftentimes they felt really frustrated with that. And I thought, there's got to be a better way to help these women. So I kind of started down the rabbit hole a while back. And when this opportunity came with Trevor to join the practice and start helping out the women in my community, I was like, let's do it. So I kind of started down the rabbit hole with functional medicine when I was pregnant with him about 10 years ago. And ever since, I've been doing tons of research, questioning a lot of the current conventional practices. And so it's been a really fun journey learning more and growing as a provider. I always think it's fun to learn a little bit about people outside of their professional life. So I always like to add in a few fun things about myself. So I love spending time with my family. I've got 2 kids, love being outside. I also have been into portrait photography over the last 10 years. I've photographed over 300 weddings. I love Harry Potter. I'm a coffee enthusiast and I love a good burrito bowl. So if you love any of those things, you're in good company tonight. So I wanted to start with a disclaimer, just to make sure that you guys are aware that the information we're going to be talking about tonight is for educational and informational purposes only. I'm not here to provide any medical, psychological, or nutrition therapy advice as part of this presentation. You should not use this information to diagnose or treat any health problems or illnesses without consulting your own medical practitioner. So always seek the advice of them about any of your specific health situations. And you can definitely read the full disclaimer on our website if you are up for it. So who is this webinar made for? You're in the right place if you are feeling tired of feeling off balance, whether that's hot flashes or night sweats, you're feeling more fatigued and not like yourself. And maybe you're looking for more natural solutions to your problems. That's a huge focus of what we do here at Valley Vital Medicine, is getting to the root cause of your issues. It's the right place for you if you feel like, hey, Just because I'm going through perimenopause and menopause, it doesn't mean that my life is over and I just have to struggle with it. I can really be empowered and feel youthful again. Then this is the perfect place for you to be tonight. And also, if you're just seeking expert guidance, you want to know, like, okay, what are the actual facts and information when it comes to optimizing your hormones and improving your health and your overall well-being. So what we're going to talk about today, of course, perimenopause and menopause, we're going to talk about understanding the signs of any hormone deficiencies. What are the benefits of estrogen, progesterone, and testosterone? We're going to talk about what hormone replacement therapy is, the benefits and the risks, and then, of course, how we approach perimenopause and menopause at Valley Vital Medicine and what kind of sets us apart and makes us different. So I love a good graphic. This one was fun, but make sure you watch until the end of the webinar because we do have a special offer for you. So stick with me, I promise it's going to be good. So what is perimenopause? So perimenopause for most women typically begins in their 40s, but for some women it can begin as early as your mid 30s. This is a time when your body is going through a hormonal transition, and it's really driven by shifts and changes in your progesterone and your estrogen, which is created by your ovaries. So during this time, the body is really trying to recalibrate and figure out hormones as those reproductive years start to slow down and wind down for us. So during perimenopause, the most common symptom that women notice is more irregular menstrual cycles or periods. They can also start to notice symptoms like hot flashes, night sweats, and changes in their mood, whether that's being more irritable, noticing anxiety or depression that they hadn't struggled with before. But those are some of the more common symptoms that might tip you off that you might be entering perimenopause. And then menopause. So menopause is technically defined as the official end to your reproductive years as a female. So that is after you have had 12 consecutive months without a menstrual cycle. So once you've hit those 12 months, the following day, you've completed menopause. So what happens is in menopause is your ovaries go on retirement. So they have stopped producing the lovely estrogen and progesterone. And that's where we definitely start to notice a significant increase in some symptoms. So this process is natural, it's biological, that's how our bodies were designed. And usually for most women, this happens in our late 40s or our early 50s, with the average age typically being around 51. Oop. Okay. I saw this quote and I thought it was really fun leading into talking about signs and symptoms. We are often taught to dismiss symptoms as just part of getting older, but these symptoms are your body's way of speaking to you, so don't ignore them. So a lot of the times as women, we go and see our primary care provider and we tell them about all of these symptoms that we're struggling with, the hot flashes, you're not sleeping, you feel like crap, you don't have energy, you're more irritable or moody. And a lot of times that gets dismissed as, well, you're just going through the change. And many times we're not given the opportunity to fix those symptoms and treat them in a way that actually helps. Many times we get thrown with antidepressants and other type of medications similar. And so I think it's really important to honor those symptoms and get with the right practitioner who knows how to treat them during menopause. So what are some signs and symptoms? So the most common signs and symptoms that we think of or associate with menopause is going to be the hot flashes and night sweats. But I wanted to create this list of additional symptoms that I feel like a lot of women aren't, like, they're not aware of and they don't associate with menopause. This list is not all inclusive. Some experts suggest that there's over 60 symptoms associated with menopause. So this is just a few of them. And I threw some in here that I think most of us are like, whoa, would have never thought that that was associated with menopause. So trouble sleeping. A lot of my clients have been telling me that they wake up at 2 or 3 in the morning, can't get back to sleep. That can certainly be a sign of menopause. We've been talking a lot about the mood changes, so being more irritable, new anxiety or depression that's creeping up. A big one that some of us are familiar with would be the genitourinary symptoms. So experiencing vaginal dryness, pain with intercourse, and frequent urinary tract infections. That can absolutely be a sign of menopause and estradiol deficiency. Another big one that I hear a lot of my clients talk about is brain fog. They struggle more with like their executive functioning, difficulty with concentrating. Some people might even get a new diagnosis of ADHD during this time, which could definitely be signs of menopause. Fatigue is also a big one as well. One that I never realized until I really started getting into the literature and research on this was heart palpitations or even arrhythmias. Joint pains, muscle aches. Estradiol plays a big role with skin health. So we start to notice our skin thins, our hair thins, we get those wrinkles, headaches and migraines. Another one I hear about a lot is changes in body composition. A lot of females start to notice that their midline starts to expand despite not changing any of their lifestyle. So they're still eating the same, exercising the same, nothing has changed, but they're noticing their waistline expanding. And that's typically what's happening is they're starting to accumulate visceral fat. That's that fat inside that we can't see. And so the waistline starts to expand. So you might notice some weight gain with that as well. Another one that I didn't even realize or was trained about was the impact on the heart. So you can start to notice your cholesterol going up, your triglycerides, even your LDL. So checking lipid panels is definitely important with your primary care provider because in menopause, those can start to creep up as well. A big one most of us have heard of or aware of also is osteoporosis. Testosterone and estradiol play a big role in osteoporosis prevention. And then another one that I thought was super interesting and hadn't heard of before either was vertigo or dizzy spells. And even things like itchy ears or ringing in the ears are part of the symptom list associated with the menopause. So what can we do? That's the big question, right? You have all these symptoms, you know you're going through perimenopause or menopause. So what are your options? That's what we're going to kind of dive into here next. So understanding hormone replacement therapy. So it's a big buzzword right now. I feel like there's a movement happening in social media where more people are talking about it, but what exactly does it mean? So HRT or hormone replacement therapy is just a personalized approach in managing your symptoms of perimenopause and menopause. So when I think of hormone replacement therapy, I think of two things. I think of one, the benefits of protection against chronic diseases. And the other part I think of is, of course, like symptom management, helping with those symptoms that you're struggling with while you're going through perimenopause and menopause. So here at Valley Vital Medicine, we really advocate for using bioidentical hormones, which just basically means that it's chemically identical to the hormones that your body would naturally make. And oftentimes some of these hormones can be sourced from plants, which is pretty fascinating. So some of you, depending on your age, may have heard a lot of myths surrounding hormone replacement therapy. And so I wanted to make sure tonight to spend a little bit of time encouraging you and reassuring you on the current data and literature surrounding hormone replacement therapy and why there has been this big, dark cloud over HRT and why so many practitioners in the conventional world are against it. So I want to talk a little bit about the Women's Health Initiative study. This was a big study that was conducted back in 1998. The goal of this women's study was to uncover the risk and benefits of hormone replacement therapy, and to also determine its role with chronic disease prevention. So in this study, I'm going to kind of like explain the background of the study to you so you get an understanding. So what they did was they enrolled women from ages 50 to 65. The average age was 63 years old, which is a really important key factor when we're thinking about the data, is the age of these women. So earlier, I mentioned to you guys the average age of menopause was what? 51. So these women are already well past, on average, well past 10 years past menopause, okay? So then they created two groups of women. And the first group of women still had their uterus intact. The second group of women did not have a uterus due to a hysterectomy. So in that first group of women that still had their uterus intact, they gave them synthetic hormones that included estrogen and progesterone. Or they were a placebo group, just meaning maybe a sugar pill. Who knows what was in it, but it wasn't, wasn't hormones, okay? So that was group one. And then in group two, they gave the women just synthetic estrogen or the placebo. So they followed these women for 8.5 years. And what they noticed was that in the first group, group one, the women who had a uterus, who were given estrogen and progestin, both synthetically, meaning not identical to what your body makes, they noticed that that group had a reduced incidence of colorectal cancer and a reduced incidence of osteoporosis related to fractures. But they noticed a very minor increase in breast cancer in that group. And that increase was very minor. So it went from estrogen and progesterone only increased the risk to 5 in 1,000 cases instead of 4 in 1,000 cases. In group two, what they found, so that was a group again that did not have their uterus and they were given estrogen only. They had no increased risk of breast cancer or cardiovascular disease. They had reduced osteoporosis related fractures and reduced colorectal cancer rates. Group two, for breast cancer rates, they had 30% reduction compared to the placebo group. They also, for the women ages 50 to 59, had 40% lower risk of a heart attack compared to the placebo. But what happened was the media took hold of this tiny little increase in the group of synthetic estrogen and progestins and blasted it all over Time magazine. So everyone quickly stopped taking their hormones. All the providers stopped prescribing them. And this was before even the data was released to the public that all of this was pushed out to the media. So unfortunately, a lot of misinformation happened and women stopped taking their hormones. And there's been studies now to see that morbidity and mortality actually raised in the women that stopped taking their hormones. So very important information. Now it has all been debunked and they've redacted a lot of the information that was posted in the media. And so I think we've learned a lot of important information there. And that is that it actually reduces the risk of cancers, of cardiovascular disease, and osteoporosis. And also, it's important to note that in this study, they did not use bioidentical hormones at all. They only used synthetic hormones, and the group with the small increase in breast cancer rates was the group that was getting the synthetic progestins. Okay. So what are the benefits of hormone replacement therapy? So we kind of talked a little bit earlier about how there's kind of two parts here. The part where you're getting relief from your symptoms of menopause, and then also those protective benefits. So some of the protective benefits, it improves bone health, so preventing osteoporosis. And of course, we definitely do not want to increase our risk of osteoporotic fractures. Women who have a hip fracture are 20 to 30% more likely to die within the year following a hip fracture. So if we can prevent osteoporosis, so important. Heart health benefits, improved genital urinary symptoms. We've talked a lot about mood, how it can help with mood stabilization. There's cognitive benefits, and then of course, just overall quality of life improvement. So I think it's really important to talk about the FDA and their approval of the use of HRT. So if you go and talk to your conventional practitioner, oftentimes they're going to tell you that certain hormones aren't FDA approved. So I thought it was important to cover here and give you guys the information. So the FDA approves the use of hormone replacement therapy for 4 reasons: hot flashes, night sweats, genital urinary symptoms, or the prevention of osteopenia. So it's really important when you're having conversations with your provider that you understand that technically, yes, we're using some of these hormones off label, but a lot of your practitioners use medications every single day off label. For instance, you're going through menopause and you're having hot flashes and you're miserable. Instead of replacing the hormones that your body's not making anymore, oftentimes they're going to put you on an antidepressant or an SSRI to help you with your hot flashes. Well, SSRIs are not indicated for hot flashes, so they're using them off label for the use of prevention of hot flashes. So just some perspective to kind of keep in mind that although it may not technically be FDA approved in some of the uses that your practitioner might recommend, there's tons of medications that we use off label, and hormones are 100% safe. The data shows that, okay? So let's break down the 3 major sex hormones that we talk about when it comes to hormone replacement therapy in perimenopause and menopause. The first one being estrogen. We kind of use that interchangeably with the term estradiol. So estradiol is actually a type of estrogen, but just important to know that some practitioners use them interchangeably. So estradiol can help maintain our bone density. It's very protective of our heart and our blood vessels. So earlier when we talked about how it can decrease cholesterol, triglycerides, your LDL, super important for that, and also reducing your cardiovascular risk as you age. It's good for improving your overall vaginal health. It enhances lubrication, again, reduces those risks of recurrent urinary tract infections. If any of you out there are struggling with that issue and you go to your practitioner and they're giving you just a standby antibiotic, you could just benefit from some estradiol, and we could avoid putting you on unnecessary antibiotics. Estradiol is really good for supporting your cognitive function. It protects against age-related cognitive decline when we're talking about dementia and Alzheimer's. Again, it's a really good support for collagen production. So when we're thinking about fine line, wrinkles, dry skin, thinning hair, it's an immunomodulator, which I never knew until I really started doing my research and learning more in this area. So as an immunomodulator, it's anti-inflammatory, which is really important in stroke prevention. And again, in lowering cancer as well. So overall, estradiol reduces morbidity and mortality. Progesterone is another one. So progesterone, we kind of think of this one as our calming hormone. So before perimenopause or menopause, progesterone can be very beneficial for women who are struggling with PMS symptoms or PCOS, or even for some women in perimenopause who are struggling with like premenstrual mood disorder or PMS symptoms, PCOS, progesterone is very beneficial. It's great for sleep. So a lot of us women who are struggling with sleep at night, that's a perfect one to take before bedtime to help with sleep quality. It's protective of the breast, so protective against breast cancer. It's protective of the uterus, protective against uterine cancer. It's really great for improving anxiety and depression. So if you're starting to notice in your 40s and 50s that you're struggling with anxiety and depression that you've never struggled with before, can be really beneficial for that. Progesterone also is protective for the heart as well and your blood vessels, just like estradiol. And this one also reduces overall morbidity and mortality. And then the last one we talk about quite a bit is testosterone. So every time We hear the word testosterone, we instantly think of like a big muscular man with all this roid rage, ready to go and like smash a car, right? Well, women make testosterone too, and no worries. We're not trying to turn anyone into a raging male, okay? So testosterone has a ton of benefits. So it also is protective against the heart and your blood vessels. It can help in reducing that visceral fat that we talked about earlier. It's great for adding or maintaining your muscle mass. It's great for boosting libido and your sexual function. It's really good for bone health as well. So it can improve your bone density. It's anti-proliferative, so protective against the uterus. It's breast protective, and it's also another hormone that overall reduces your morbidity and mortality. So tons of benefits to all three. So I know some of you might be wondering, what are contraindications of hormone replacement therapy, or who shouldn't? I'll preface this by saying that you always need to have an informed conversation with your primary care provider when it comes to hormone replacement therapy. I can't individually tell each of you what is right or wrong when it comes to hormone replacement therapy, but I can just give you a general outline. So if you still have a uterus, and you are on estradiol therapy, you must be on a progesterone. So if you go to a provider who's trying to put you on estradiol without also giving you the progesterone, you need to see another provider, okay? So you do not want to take any estradiol that's unopposed from the progesterone. What can happen is the estradiol can create the proliferation of the lining of your uterus, where it begins to thicken, and it can put you at higher risk for uterine cancer. So the progesterone opposes that and keeps that lining thinned. So if you have a uterus and you're going on hormone replacement therapy, you need to have the progesterone with the estradiol if you're taking it. Any female who has active breast cancer would not be a candidate for hormone replacement therapy, because there are breast cancers that are driven by progesterone and estrogen. Another quote, because I love my quotes. Caring for your body, mind, and spirit is your greatest and grandest responsibility. It's about listening to the needs of your soul and honoring them. So how do we approach perimenopause and menopause at Valley Vital Medicine, and what makes it different to how we work with our clients? So we really take a functional approach. So I can have any woman in menopause come to the office, and sure, I can prescribe her hormones, but I kind of think of that sometimes as slapping a Band-Aid on an open wound. We have to make sure that your other hormones are optimized. We have to make sure that gut health is optimal, that your nutrition is good, that you're getting movement, that you aren't what Trevor loves to call a stress monkey. Got to make sure your sleep is optimized, that you are on the proper supplementation if you need it based on your lab work. And then, of course, we provide a lot of that support and guidance that women need when navigating perimenopause and menopause. So I wanted to kind of break down every area and just share with you some tips that I've been discussing with my clients that I'm putting on hormone replacement therapy. So hopefully you get some good takeaways here. And forgive me, I took notes because there's a lot of good information. I want to make sure I didn't clutter the slides too much, but I gave you some good information on each of these areas. So gut health is a big one that we focus on here at Valley Vital Medicine. Having a healthy gut microbiome is super important when it comes to metabolizing your estrogen. So we want to make sure that you're able to metabolize and detoxify from estrogen. That's going to help reduce symptoms of things like the hot flashes, the mood swings, and the weight gain. So that's really important for the metabolizing of the estrogen. Proper gut health also helps to support the absorption of critical nutrients. So things like calcium, magnesium, your B vitamins, vitamin D. Those are all needed to offset your bone density loss. So if gut health isn't good and you can't absorb those critical nutrients, of course, that's going to affect our bone density. It's going to affect our energy levels, causing fatigue, and also our mental health as well. In perimenopause and menopause, chronic inflammation can worsen symptoms and increase the risk of conditions like osteoporosis, cardiovascular disease, and metabolic syndrome. So again, optimizing gut health so we can absorb those nutrients that our body really needs. Um, a healthy gut also helps to reduce chronic inflammation and support our immune system by reducing what we call intestinal permeability, or what a lot of people of us have heard it as leaky gut. That can definitely contribute to inflammatory responses in the body and drive things like cancers and cardiovascular disease, things like that. We also want to make sure that we're really balancing out our gut flora, so that we can minimize immune system overactivity. We can lessen symptoms of things like joint pain, mood swings, cognitive fog, things like that. Um, During that shift of perimenopause and menopause, with those changes of our estrogen and our progesterone, that can definitely, like we've talked about, impact our mood and increase our risk of anxiety and depression. If we have a really well-balanced microbiome, that can help support our serotonin and our GABA production. And these are essential neurotransmitters for mood stabilization, focus, and sleep. So again, tying into that brain health there. And then the last thing is stabilizing our blood glucose levels. So when we're having lots of fluctuations in blood sugar levels during perimenopause and menopause, that's typically happening due to insulin sensitivity and changes in that area. So having good gut health can definitely help regulate our blood sugar. It can help stabilize the blood glucose levels, so it can help with things like avoiding energy crashes, the mood swings, cravings, things like that. So we really focus on the overall gut health as part of our perimenopause and menopause care. Thyroid optimization. So thyroid could be its own complete webinar, which hopefully in the future we could definitely do a thyroid optimization webinar for you. But I just wanted to briefly touch on the importance of also optimizing our thyroid before looking into only our hormones and HRT. So many of us know our thyroid is super important in managing our metabolism, our energy levels, our hormones. Our thyroid is regulated through T3 and T4. It's really essential for cellular energy production. And optimization is really critical when we're thinking about perimenopause and menopause. Nutrition. I know this is always a fun one to talk about, but I wanted to talk about some of the key points with nutrition when we're entering into especially perimenopause. So with nutrition, super important that we're getting adequate protein intake. Most women, I mean, we probably barely hit 50 grams of protein a day. Protein is super important to maintaining our muscle mass. Naturally, as we age, we start to lose our muscle mass. So when you think about yourself in your 80s and 90s, how do you envision yourself? Frail and prone to fractures and demented in long-term care? Or do you picture yourself, feeling youthful, down on the ground with your grandchildren playing, climbing stairs, living at home, completely independent? Yes, well, you're going to need some protein and you need to keep your muscle mass. So ideally, if we can focus on 1 gram per pound of your ideal body weight, that is a great place to start to maintain that muscle mass that we really need to support ourselves. Focusing on a whole food diet, so eliminating processed foods. So if you can't pick it, pull it, or kill it, you probably shouldn't eat it. And I know that's no fun, but eliminating processed foods and sugars and really focusing on whole foods in the diet. Fiber is another big one. So we talked a few slides back about gut health. Fiber plays a really big role in our overall gut health when it comes to estrogen metabolism, as well as feeding our gut microbiome. So if we can ideally aim for 25 grams of fiber a day, that would be perfect. And again, most of us are super deficient in fiber. Ideally, if we can get it from our food, that's best. But if you need to, we can supplement with fiber if you're not able to get enough in your diet. If you are like me and you're starting off with really low amounts of fiber, go low and go slow on it. Don't go straight to 25 grams a day or your gut will not be happy initially. All right, next one is movement. So we talked about the importance of protein and maintaining our muscle mass. Part of that is also going to be intentional movement throughout our week. So if we can really focus on resistance training 3 times a week, that's going to be important in building that muscle mass, maintaining and improving our bone density, helping boost our metabolism because we already know that we're gaining visceral fat and gaining weight. And then, of course, that we have the benefits of enhancing our mental health, helping with our anxiety, depression, things like that. Another big one that there's tons of data coming out about is walking with a weighted vest. So there are studies that have come out about walking with a weighted vest and its benefits in strengthening your bone tissue, and actually reducing your risk of osteoporosis. So if you're already a walker, try adding in a weighted vest, ideally 5 to 10% of your body weight a couple times a week. And then you're also going to get that benefit of improving your cardiovascular health by getting your heart rate up, hopefully like zone 2, zone 3. And you kind of get a double whammy there. So adding in the weighted vest can definitely be beneficial there too. This one's a hard one, and I feel like I relate to the girl in this picture so much, but stress reduction. I know you hear it a lot. Don't stress, right? But seriously, don't stress. So, what can we do to help with stress reduction? Go outside. Get outside, get some sunshine. We're about to hit winter, and a lot of us know what happens in the winter, getting those winter blues. But getting outside as much as you can is going to be super important. You can do things like grounding. So if you haven't heard of what grounding is, that's when you make like direct physical contact with the earth's surface. So walking barefoot, sitting on the ground, using grounding equipment or just being in nature has definitely been shown to reduce stress, inflammation, decrease pain. It can improve your sleep quality and also just calm the nervous system. Mindfulness meditation, that's a great way of training your mind to focus, to be present in the moment. Can definitely help with alleviating anxiety, improving emotional stabilization or stability, and can also provide kind of that sense of calm that a lot of us ladies need. Breath work is another one. So I tend to like the box breathing. That's where you do the 4-4-4. So you inhale, hold it, exhale, hold it. That's actually been shown in studies to be really good at activating the parasympathetic nervous system. And it can reduce our cortisol, which we know is associated with stress, right? Helping your body kind of shift out of that fight or flight state. So definitely something that you can try to help with your stress reduction. This next one I thought was super interesting. And in my work working with Medicare aged individuals, this was a big one. And that's socialization and connection. So connecting with friends, family, support groups, I mean, really anything, a church group, can really help reduce feelings of isolation and enhance your overall emotional well-being. I found some really interesting studies actually that I wanted to share with you about that. There was a study showing that the lack of social connection was associated with a significantly increased risk for early death for all causes. So this is data from the US Surgeon General's Advisory Board. They looked at 148 different studies that suggested that social connection increases your odds of survival by 50%. So just go hang out with a friend and you can increase your odds of survival by 50%. Furthermore, they found that social isolation was associated with a 29% increased risk of heart disease, 32% increased risk of stroke, and it also increased the risk of dementia in older adults by 50%. So super important to just connect and be around people. Another one that I love personally is journaling to allow myself to process my feelings, reduce my stress, kind of gain perspective on things going on in my life. There's great therapies out there like CBT. which can be really good at managing stress and anxiety. This is one that I've definitely learned a lot in my 30s, setting boundaries, saying no, protecting your inner peace, taking breaks, engaging in activities that you really enjoy and that promote joy for you and relaxation, whether that's just reading a good book, taking a hot bath, things like that. So really focusing on some of those areas. I know for a lot of my clients who are uber stressed out, they feel overwhelmed about the thought of like self-care and when are they going to find the time. But I always encourage my clients, like, even if it's just 5 minutes of your day, if you can do a mindfulness meditation, quick write down your thoughts, take a hot bath, I mean, anything. Make sure you're doing that self-care. Next one is sleep optimization. So making sure that sleep is looking good. So I recommend our clients tracking your sleep. So there's tons of great tools out there. I know a lot of people really like the Aura Ring. Another alternative is called the Ring Con, which is basically a knockoff of the Aura Ring. But the Aura Ring is super helpful at tracking your sleep, telling you what kind of light, deep, or REM sleep that you're getting, the overall quality and duration of your sleep. It can give us some really good data to kind of understand where you're at with your sleep. We all know that getting that restorative deep sleep and REM sleep is really important when we're talking about things that are essential, like memory consolidation, physical recovery, mental processing, things like that that need to be happening when we're sleeping. Number two, I struggle with, and that's being consistent. So going to bed at the same time every night and waking up at the same time every day, even on the weekends. My husband, bless him, he's so nice to me and lets me sleep in an extra hour on the weekends, but super important to be consistent. That can help regulate your circadian rhythm. Again, help improve that sleep quality and make it easier for you to fall asleep more naturally. Setting your environment is important, so make it dark, quiet, and cool. Limiting blue light at least, an hour before bedtime is ideal. Blue light can interfere with your body's natural production of melatonin, that nice sleepy hormone that we need before we go to bed. Heavy meals, avoid those before bedtime because we know if we lay flat after a plate of spaghetti, you're gonna be upset at yourself. So make sure you avoid eating heavy meals at least 2 to 3 hours before bed. And then of course, limiting your caffeine and your alcohol, that can definitely impact your sleep quality as well. Supplementation. So before we kind of go through these, I did want to preface it by saying before you start supplementing, it's really important to sit down with your practitioner, get some good lab work done, and really evaluate like what is your status with some of these before you start supplementing, okay? Which we definitely do here at Valley Vital Medicine is get a full comprehensive lab panel before we start supplementing. So some of the important supplements that can support you in perimenopause and menopause, the big one is omega-3 fatty acids. We know those to be anti-inflammatory, which is great for reducing your risk for heart disease. It's essential for our brain health, protecting our skin barrier. Vitamin D is a big one that we all have heard of, and pretty much all of us are deficient in it. That's really critical for our calcium absorption, which helps us to strengthen our bones and reduce our risk of osteoporosis. It's great at boosting our immune function, again, reducing risk of cardiovascular disease, and it's even protective against cognitive decline. Next one is our B12. So B12 is very vital for energy production. It protects our brain health. It reduces our risk of cognitive decline. It helps us to synthesize different neurotransmitters like serotonin and dopamine. So supports that mood stability that we often need in perimenopause and menopause. It also can protect the myelin sheath around your nerves. So if you know people in your life that are starting to notice that numbness, tingling in their hands, feet, or neuropathy, and it also supports our red blood cell production. The next one was an interesting one, which I hadn't done a ton of research on until I really started diving into the hormone space, and that's creatine. So creatine, a lot of us think of again like bodybuilders, right? But we're actually finding that creatine is really good for supporting our muscle and our bone health and also our energy levels as well. So you'll see a lot of experts in the menopause space recommending replacement with or supplementation with creatine. The last four here are specific supplements that our practice does carry. The first one is HRTT. This is a supplement that helps provide support with estrogen metabolism. It also provides antioxidant support. It can help with cognitive function, and it can optimize hormone balance by supporting testosterone therapy. So that's one that we carry at our practice, and we often will recommend our clients who are doing like pellet therapies and things like that, just as an adjunct. The next one is Rocasa, our hormone kit. Some of you might be big Rocasa fans. We have a lot of those at our practice. We have a kit with essential oils. So each blend is formulated with 100% pure therapeutic grade essential oils that contain different properties that can help support and balance and regulate your hormones. And we have a whole protocol sheet printed out at the practice that we can get you so you know how to use the oils, when to use them, where to apply them, that kind of thing too. Next one is perimenopause support and menopause support. So these are just specific proprietary herbal blends. They call it Estro G100. That's been clinically proven to help promote balance of hormones throughout kind of that reproductive transition. We carry both of those in our practice too. All right, guys, you made it to questions. So does anybody, after all of this information, I know I threw a lot at you, does anybody have any questions for me that I can answer for you? And I believe earlier Trevor said the chat feature for some reason is not working. So if you're having troubles with the chat feature, you use the Q&A. So if anybody has any questions, feel free to pop them in the Q&A. Okay, so Shayla asks, so if you have been on birth control for years, when is a good time to stop, especially when not bleeding? Anytime is a good time to stop. Anytime. And it really depends on, why were you on it in the first place? And there would be a lot of follow-up questions to that, but honestly, you could go off of your birth control at any time. And that could definitely be, shared decision making with your primary care provider to discuss your options there. I mean, there's a lot of factors that come into play when we talk about that, like why you were put on it, your age, reproductive history, things like that too. Tom says, great presentation. Oh, thanks, Tom. I'm glad you were here. I hope some of it was helpful to you and helpful to your clients. Is estradiol prescribed before menopause to help alleviate the big fluctuations? So there's kind of different practices in this regard. Some providers will give women they call it a whiff, just a tiny little dose of estradiol for women if their levels are super low and they're showing a lot of symptoms of estrogen deficiency. So yes, there are some individuals who will be prescribed it in perimenopause, but generally speaking, it's for most people during menopause that we prescribe that. A lot of women in perimenopause do wonderful just on the progesterone and the testosterone only. But that's a really good question. Great presentation. Thank you, anonymous attendee. Does insurance cover any of this? So at our practice, we are a cash pay practice. And the biggest reason for that is we don't want insurance dictating what we do with our clients. So there are definitely options if you have insurance to see and submit to like the pharmacy. There are certain hormones that your insurance will cover when it comes to the actual hormones that you could be prescribed. It just depends and it's very individualized. There's several different methods when it comes to hormone replacement therapy. There's pills, patches, injections, pellets. I mean, several different modes. There's creams as well. So it really depends on what you decide is best for you, your lifestyle, all of that. And then, of course, we can submit to insurance and see what they'll cover from a pharmacy perspective. Julie, it seems like a lot of positive benefits of bioidentical hormones. Are there serious risks women should consider? Great info. Thank you, Julie. So honestly, the only contraindication is going to be if you have active breast cancer. Otherwise, I kind of think of it this way, and I've had quite a few experts, like leading experts in this field, describe it this way too, is like you went your whole life with high amounts of estradiol, high amounts of progesterone, high amounts of testosterone. When we go into perimenopause and menopause and we replace those, we don't quite get you to those levels you were when you were younger, but you were fine. Physiologically, your body was making these high amounts. And so really it's the safety and efficacy behind them. I know when it's my turn, I'm gonna be like, sign me up and give them to me until I die. Because I envision myself being strong and active and healthy, feeling youthful. This was really cool. Today, I had a follow-up with one of my clients. A month ago, we started her on progesterone and estradiol, or no, I'm sorry, progesterone and testosterone. And we did our follow-up today, and she was like, I've never felt this good. I feel like I did 20 years ago, and she's in her 40s. So I want to feel that way when I'm in my 40s, like I'm 20 again. All right, anonymous attendee. If I'm 62 and had a total hysterectomy 7 years ago and have never been on HRT, is it too late or what would your, it's never too late. You definitely still want to sit down with a provider and have a discussion, but it's never too late. So you could start anytime. There was prior guidelines that talked about only prescribing hormone replacement therapy if it was within 10 years of when your menopause started. But now there's more literature coming out debunking that and saying that's not necessarily true. We can give it any time. So Kara, if you're having vaginal dryness, pain during intercourse, and perimenopause, are you able to use vaginal estrogen? Yes, I would 100% be okay with that. Vaginal estrogen is very localized, it's not systemic. So yes, you could 100% do that. Jana, I've recently had full lab work at my OB-GYN. Can you use them at your practice instead of having them done again? So it really depends, Jana, what blood work they did. A lot of my clients will tell me, I just had full blood work, and when I look at it, it's very minimal. So when we do a lab panel here with our new clients, we are looking at complete blood counts, your metabolic panel. We're looking at insulin, hemoglobin A1C, your B vitamins, vitamin D, an iron panel, a cholesterol, like lipid panel. We're looking at all of your female sex hormones. We're looking at cortisol, homocysteine. I mean, there's tons of labs that we're checking into. So it would really depend on what you've had checked. So I'd have to see. Rita says, what are the pros and cons of the types of delivery? Oh, that's a great question. Okay, so let's talk about the different methods. So when it comes to estradiol, I'll just break it down by hormones and then different delivery methods for each one. So for estradiol, your options are you can take oral estradiol, you can do a patch, or you can do like a cream, and they even have some like little like sprays that you can do too. I'm not as familiar with the sprays. Honestly, there's so many different delivery methods. So when it comes to those different forms of delivery methods, it's basically convenience. So for instance, estradiol patch you can put on twice a week. So you only have to remember to put it on and take it off twice a week. If you're doing the cream, you have to remember to put it on every single day. So pros and cons of delivery methods. We can also do estradiol in the form of a pellet. So if you guys have ever heard of pellet therapy, it's basically a minor procedure that we do in office where we clean the area at the top of your butt cheek. So we clean it and make a tiny little incision. And then I have a instrument or tool that I use to put in that fat layer. And we insert the tool and then place the pellets right in your skin. So, or in that fat tissue. So usually 1 to 3 pellets, depending on the individual. And then the benefit of that is the pellets stay there for 3 to 4 months for women, and they give you a nice, slow, steady, constant release of the hormones instead of these spikes and dips like you would have with applying a cream or doing an injection or things like that. Um, as far as progesterone, the only way that I'm prescribing that is as oral micronized progesterone. Topical application just doesn't work for people. So if you're one of those people who has like bought it over the counter, I'm sorry to tell you, but it doesn't work. So I've been prescribing the oral micronized progesterone. So that's a pill, and honestly, that's really your best option there. And then when it comes to testosterone for women, you can do topical, so in the form of a gel or a cream. I usually do the cream because it absorbs better, not as messy. And then you can also do pellets. So for the pellets, we can do the estradiol or the testosterone. And then on very, very rare occasion, I haven't dabbled into this, but women can do the injections too. But of course, with any injection, you're having to poke yourself and administer it. I believe it's every 7 to 10 days, but that isn't something I have dabbled into because I just not a fan for women to do the injections for testosterone. Hopefully that helps answer your questions there, but let me know if you have follow-up ones. Um, Tom has some good questions. If a woman is taking either synthetic hormones or even bioidentical, does she need to wean off them if she wishes to stop using them, or can they quit cold turkey? You could quit cold turkey. I mean, you're gonna feel like crap again. So I definitely would not recommend. I actually had a client ask me that today. She was like, "So is this just a temporary thing with the hormones?" And I was like, "No, you can be on these forever. Let's get you on them, see how you're feeling. And when you come back and you tell me how much you love your life right now because you have all this energy and you just can think clearly again and your mood's improved and you're sleeping great, you're gonna want to stay on it forever." So honestly, haven't had many people or actually anyone stop their hormone therapy at this point, but you could quit cold turkey. It isn't like an SSRI where you'd have to like wean off. What are the best labs a patient should ask their provider to test for overall hormone status or this night? Yeah, it's totally relevant. So I kind of mentioned before the full lab panel that we do here, but as a baseline, they should be getting like a CVC. You should be checking their iron, their ferritin's really important. You should be checking their sex hormones, of course. So estradiol, progesterone, DHEA, testosterone, their sex hormone binding globulins important. Cortisol, fasting insulin, thyroid panel. Am I missing any, Trevor? I feel like those are a good place to start. But I think those would be really important because we want to make sure that we don't have any metabolic issues going on. Thyroid looks great. And then of course their actual sex hormones too. But great questions, Tom. Jody,
Yeah, a
do you
couple other
prefer?
ones that generally we'll check. We'll also look at the inflammation status too. So
Mhm.
thinking about CRP, homocysteine, um, and then yeah, for each of the hormones, it's really really important to make sure that we're checking the progesterone, testosterone, estradiol, DHEA, kind of the things that you talked about, vitamin D, B12, folate. We check an A1C on every single one of our clients, just to make sure that we know where that 3 month average of blood sugars is. And the insulin is super, super important. And then we also look at cortisol too.
Thank you. I'm starting to get a little brain fatigue, so I know I'm forgetting some. So thank you. Two brains are better than one. All right. Jody said, do you prefer saliva or blood testing? We do blood testing at our practice. Haven't dipped into any saliva testing, and honestly, a lot of the trainings that I've done and the experts have not recommended the saliva testing. I am looking into doing more with urine testing, so that's more that I'm learning about. I actually just did a just a quick introduction to a company called Mira, which you can do your own urine hormone testing at home. And the data can be synced with like a provider dashboard where I can log in and see actually day to day what your hormones are doing, which I think is really fascinating. And they're sending a kit for me to try on my own. So I'm going to test it on myself and see what I think. So I think urine might be something that I'll dabble more into, but for now we've been doing blood testing and that's been great. Julie asked, with the testosterone HRT in women, what are the chances of facial hair growth, other male characteristics, etc.? I've heard women have that happen while taking testosterone. Have you seen that happen? I have not seen it happen on my clients, but what can happen is if you have a provider who doesn't know what they're doing and they're giving you like seriously insanely high amounts of testosterone. Yes, that can happen, but I haven't seen it, and none of my clients have I heard of them having that issue with, like, past treatments they've been on. When you're applying the testosterone cream, it can cause, like, increased hair growth in that area where you apply it, so, like, the testosterone cream, you can apply it to, like, your inner upper arm, your inner thigh, or directly to the labia, depending on what the base of the cream is, I should say, caveat. So you can see a little bit of increased growth in that area, but I mean, I honestly don't care if I have a little extra leg hair, I'll just shave it. Or you can come see our aesthetics gals and do some laser hair removal. Other like super high doses of testosterone, you can see women start to get like hair loss, acne, things like that, but we're talking very high doses. I am one to think along the lines of go low, go slow. So I am starting at lower doses with my clients and titrating them up until they get to a level where symptoms have improved, they feel great, and we're getting the protective benefits of the hormones too. Rita, can you give a cost estimates of hormones if self-pay? Are hormone formulations toxin-free? So it's super, I wish I could give you an accurate number, and I tried to do this with the compounding pharmacy we work with. It's super hard to give you an accurate number of how much the hormones will cost you if you're using like a compounding pharmacy. It really depends on the mode that you're using, and if you're going if you do have insurance, like sometimes um certain hormones will be covered, like sometimes the estradiol patches will be covered, things like that. So it's really hard, but I want to say an average is probably around $100 a month. If you're doing all three. It really depends on what you're taking, but I can't give an exact estimate. I wish I could. Are hormone formulations toxin free? Yes, 100%. We are not about toxins over here at Valley Vital Medicine. So we only use bioidentical clean ingredients. Um, so yeah. Anyone else have any questions? Those are great questions, you guys. Love it. All right, so I'm gonna close out of this. So what are your next steps? So maybe this presentation really resonated with you today and you feel like, wow, I'm in perimenopause or I'm in menopause, I wanna feel better, help me. So your next steps would be to book a discovery call with me. That is how we bring clients into our practice at Valley Vital Medicine. So you can hop on to our website, valleyvitalmedicine.com/call, and you can schedule a time to do a discovery call with me. So the discovery call is a great opportunity for us to spend a few minutes discussing what your health goals are, talking about what we offer here, making sure we're a good fit, and then getting you scheduled for your wellness.